Today's topic for our conclusions and observations is autism. Autism belongs to the domain of mental disorders, or more specifically, the psycho-emotional domain. In many ways, it is less about intellectual functioning and more about psycho-emotional functioning. Let's begin from a broader perspective. Where does everything start? First of all, regardless of what a person does, how they express themselves, or in what area they choose to express themselves, they need an energy resource to do so. The question is simple: do they have the energy, or do they not? When the body distributes its energy resource, the first priority is always the life support systems. If the life support systems receive enough energy resource and some remains available, the person will begin to express themselves through motor activity. That comes next. In other words, first the person must remain alive. The life support systems must continue functioning, whether well or poorly. If they are functioning well, the person will be physically active. If the person is physically active and still has energy resource available, the next level is intellectual activity. And finally, the last place where energy resource is allocated is the psycho-emotional domain. Interaction with the surrounding world, engagement with reality, and the expression of feelings, attitudes, and responses. Now imagine that the energy resource begins to decline. What will be affected first? The psycho-emotional domain. A person becomes less communicative, less engaged, less cheerful, and less responsive to the things around them that would normally evoke an emotional reaction. This is precisely what we see in autistic children. These are children who do not have enough energy resource available for emotional perception of the world and for emotional responses to external stimuli. We want them to enjoy life, but they do not. We want them to interact with us, play with us, and have fun with us, but they cannot. They simply do not have the energy. And we must understand that the first manifestation of an energy resource deficit is the fading of the psycho-emotional domain. Where else do we see this? We see it in older adults. They also become more emotionally restrained and limited. If we try to stimulate them or push them into greater activity, they may respond negatively or defensively. The difference is that in one case we are talking about elderly people, while in the other we are talking about children. At first glance, these situations may seem unrelated, but in reality, they are based on the same principle. Imagine a person who has not eaten for 1, 2, or 3 days. Will they be psycho-emotionally active? No. They simply do not have the energy. Why? Because they have not been fed. Feed them. Allow them to get proper rest, and their activity returns. But in this case, the child may be eating well and sleeping adequately, yet the energy is still not there. We do not understand what is happening. We try to stimulate the child, yet we do not receive the emotional responses we expect. That, in essence, is autism. Regardless of how we choose to classify it, the fundamental issue remains the same. If we have no methods for increasing the child's energy resource, if we cannot provide additional energy resource beyond what they currently possess, then we will continue facing the same limitations. But believe me, if that energy resource can be increased, even gradually, the child will begin to respond. At first, the changes may be subtle. Then they become more noticeable. You provide the resource, and the child begins to engage with you in return. This is why all restorative treatment approaches for children with autism begin with the same question: How do we provide them with additional energy resource? How do we cultivate it? How do we nourish it? How do we help it grow? Simply telling the child to sleep more is not enough. Simply feeding them more is not enough. These methods and techniques were developed specifically to help these children gradually overcome developmental delays and continue progressing. Naturally, autistic children often demonstrate other developmental abnormalities as well. For example, we frequently observe connective tissue dysplasia, meaning underdevelopment of connective tissue. In essence, this reflects underdevelopment of the body's internal life support environment. However, this is usually not what draws our attention. Most parents do not know how to evaluate these things, and the professionals most commonly working with these children are psychologists. They search for ways to motivate the child, activate the child, and stimulate cognitive functioning. But what often happens in practice? We try to push the child forward, and the child withdraws even further. We are drawing on the last remaining resources they have. From where? From motor activity, which is already limited. We try to redirect energy resource away from the life support systems, which are already operating at their limits. Parents do it, psychologists do it, everyone does it. And that is where the problem begins. Quite often, these children show a little bit of engagement and then fade out again. Take a typical lesson at school or in kindergarten. The lesson lasts 30 minutes, but the child can stay focused for only 5 or 10 minutes. After that, they're exhausted. The lesson continues, and the other children stay engaged for another 20 or 30 minutes. The next day, the same thing happens. Again, after 5 or 10 minutes, the child fades out. And then another problem appears. They start falling behind. Everything that happens during the rest of the lesson is simply missed. If we were giving that child information in 5 or 10-minute segments, they might be able to keep up. The chain wouldn't be broken. But after 3 or 4 days, the child becomes completely lost. Everyone else is moving forward, doing things, participating, expressing themselves, while the child withdraws, closes up, and retreats into themselves. And what happens next? We approach the child, and they cry. We approach them again, and they resist. Not because they don't want to respond, but because they can't. We're adults, and they're children. We're active, and they're weak. We have energy resource available, and they only have what they have. So naturally, this is the picture we begin to see. Imagine a small child learning to walk. Their steps are tiny. They're still unsteady. Maybe they can walk 20 meters, maybe 100. But they need to do it in their own way, with their own small steps. We want to move faster. So what do? We pick them up and carry them, or we pull them along by the hand. Come on, let's go. And in doing that, we steal time from their development. We don't give them the opportunity to go through their own ontogenetic development. Instead, we rush them. The same thing happens with autistic children. If you slow down and simply observe them, you'll begin to see what they can do, what they can't do, and what is simply beyond their current abilities. Often, what is beyond their abilities is not the task itself. What's beyond their abilities is our expectation that they should constantly respond the way we want them to. For them, that requires more energy resource than they have available. Let me give you a simple example. Imagine a person who is not in a deep coma, but in a semi-conscious state. We stand over them and say, "Come on, wake up." For them, even that may be too much stimulation. They simply can't process it. But if you speak very quietly and very slowly, the signal begins to get through. And little by little, you may start getting some kind of response. I use examples involving elderly people and people in semi-conscious states for only one reason. I want you to understand something very simple. There isn't enough energy. Give the child energy. And give the child time to develop. Imagine a child who is 3 or 4 years old, but whose developmental level is closer to that of a 1.5 or 2-year-old. Where did those missing years go? We want the child to function at their chronological age, but we're trying to get 4 or 5-year-old abilities out of a child who is still developing at a much earlier stage. The child hasn't stopped developing. They've simply been developing very slowly. And yet we keep asking for more and more. A child may fall behind for many different reasons. Maybe they were sick. Maybe they weren't exposed to enough social interaction. The specific reason isn't the point. The point is that we may meet a 10-year-old child whose developmental level is far below what we expect for that age. And where do we want to place that child? In the 5th grade. The people responsible for teaching and raising that child often don't see the whole developmental gap behind them. All the stages that were missed are simply overlooked. Then the question becomes, can that lost time be made up? Can development catch up? What kind of methodology would be needed to help that child continue developing? There's a reason people say that before you can grow a tree, you have to start with a seed, or at least with a young sprout. You can't skip the process. Everything develops step by step. Imagine finding a newborn kitten that's still blind. You feed it with a dropper. You wake up during the night because it needs feeding every hour. Growth takes place gradually, step by step. And if a person doesn't understand that process, problems naturally arise. We tend to measure children against the average child. But weaker children are different from one another. One may have fewer resources than another, and another may have even fewer. That's why autism requires an individual approach. An individual approach to the parents, so they understand what's happening, and an individual approach to the child, because there are many different forms of autism. When we work on restoring these children, our goal is to help them move toward a healthy level of functioning. Imagine that our goal is to take a fragile autistic child at 2 or 3 years of age and eventually develop them into an athlete. Think about how many steps that would take. First, they need to reach the lower end of the normal range, then the middle range, then the upper range. Only after that can we start moving them towards sports. And if we're given enough time, we may eventually develop that child into an athletically gifted individual. But all of this requires individualized programs and an individual approach. When we look at such a child from the outside, they may appear completely normal. 2 arms, 2 legs, a torso, a head. They can walk. They may even run. But that's motor activity. Their internal systems are providing enough energy resource for movement, growth, and development. In many cases, there may even be enough energy resource for intellectual activity. What is lacking is the energy resource needed for psycho-emotional and social functioning. That's where the deficit is. The energy resource is low. And if the family is interested in understanding why, then we begin looking deeper. How did conception take place? How did the pregnancy progress? How did the birth go? How was the child raised during the first year of life? When did they begin walking? Take something as simple as walking. Parents often say, well, he started walking at 14 or 15 months. And yes, technically, he did start walking. But we often forget that normal independent walking usually appears around 11 or 12 months. So if a child starts walking significantly later, we need to ask why. At that age, 3 or 4 months is a substantial period of time. It represents a significant portion of the child's developmental progress. So we need to understand why the child started walking at 14 or 15 months rather than earlier. And it's not just a question of when they started walking. It's also a question of how they walked. Walking is one thing. The quality of walking is another. The same principle applies throughout development. Some children can start school earlier than their peers and do very well. Others struggle. One child may seem gifted in mathematics. Another may benefit from an exceptional teacher. A third may have difficulties because of poor instruction. We can always find explanations. But underneath all of these explanations lies the same fundamental issue. How much energy resource does the child actually have available? When we take these children into a health restoration program, we have to remember something important. Autism is not limited to the obvious clinical cases that receive a formal diagnosis. There are also milder forms. There are transitional forms. There are children who attend regular school, who are capable of learning, but who constantly struggle. You may see one child earning average grades while sitting next to another child who excels academically, studies music, participates in sports, and seems to succeed at everything. The question is not simply whether the child can attend school. The question is what that experience costs them. How much psycho-emotional load can they tolerate? How much pressure can their system handle? Perhaps that same child would perform much better in a small class of 2 or 3 students with similar capacities. But instead, we place them in a classroom with 25, 30, or even 40 children. For some children, the noise alone may be overwhelming. There are many individual factors involved. That is why we need to examine the child's life history, developmental history, medical history, and educational history. When an individual approach is taken, all of these factors can be broken down into their component parts. Then they can be explained not only to the parents, but also to teachers, caregivers, educators, and everyone involved in the child's development. Now let's talk about vaccinations. This is an important topic. Historically, children who were considered weak or fragile were often exempted from vaccination. Why? Because it was understood that vaccination could place an additional burden on an already weakened system. That is why medical exemptions existed. Healthier children were vaccinated. Weaker children were often not. Speaking strictly from my own clinical experience, I can say the following. Unvaccinated children often begin holding their heads up almost immediately after birth, and do so confidently by 1 month of age. Vaccinated children, in my experience, may not achieve the same level of head control until 2 or 3 months of age. So which developmental standard should we use? The child who demonstrates stable head control by 1 month? Or the child who reaches that milestone at 2 or 3 months? The difference is substantial. By 3 months, a child has already undergone enormous growth and development. And that raises an important question about the developmental cost of early interventions. Now let's move on to the next question. How justified are these vaccinations? How important is the manufacturer of the vaccine itself? These questions matter as well. Personally, I would approach it this way. If a vaccination can be postponed or avoided, then perhaps it should be. At the very least, we should ask ourselves a few questions. Is it really necessary to do it right now? Could it be done later? Does it have to be done in the maternity hospital? Or could it be done at a later stage? These are all questions worth considering, because if a child is already weak and then receives a vaccination simply because everyone gets vaccinated, we may end up seeing various energy resource deficits emerge later on. In my practice, when I work with these children, I can often trace certain declines in their development back to that period. Again, I work with vaccinated children and unvaccinated children, weak children, autistic children, and children with many other conditions. But the key is always the same: an individual approach, a systems approach, an interdisciplinary approach. And I can only speak for myself. That's why I'm here, to help resolve situations that seem to have reached a dead end. Today we often encounter another situation. Parents come to me and say, "Our child was born with an APGAR score of 9 or 10. Everything was fine. How did things deteriorate so much afterward?" Let's think about that. Being born healthy is one thing. Growth and development afterward are something else entirely. And the role of the parents in that process is far greater than many people realize. We need to understand what should be done during those years. Even some of the basic principles we've accepted for decades are now being reconsidered. Take pediatric textbooks, for example. Different countries view things differently. Different generations viewed them differently as well. If you compare pediatric literature from the 1960s, 1970s, and 1980s with modern textbooks, you'll see that developmental standards have gradually been revised downward. Take modern pediatric surgery textbooks. Today, children born with tremors, nystagmus, or increased muscle tone are increasingly being treated as falling within the normal range. What does that tell us? It tells us that developmental quality is declining. That's simply the reality of the world we live in. The 20th century became an era of environmental destruction, industrial technologies, and rapid urbanization. We created artificial environments. We created cities. And these environments do not necessarily contribute to better health. Now, compare that to traditional rural populations in regions where more than half the population still lives in the countryside. Do we see large numbers of autistic children there? Not really. If we encounter such cases, they are relatively uncommon. But in cities, discussions about autism involve a significant percentage of children. And if we broaden the criteria, that percentage becomes even larger. Talk to teachers. Many of them genuinely don't know what to do. Some people advocate prenatal musical stimulation. Others promote swimming before walking. Every generation has its own ideas. But when we gather all these observations together, analyze them, and look at the whole picture, we almost always find the same thing. At some point, energy resource that should have gone toward growth and development was redirected elsewhere. We tried to push the child ahead of their natural developmental timeline, and later, we paid the price for it. Because biology always comes first. The child must grow and develop. The life support systems require their share of the energy resource. That cannot be ignored. And this is where we have to ask ourselves difficult questions. Where did we make mistakes? Where were we simply uninformed? Where were we careless? Sometimes we see families with 2 or 3 children. The first child developed normally. The second child developed normally. The third child presents significant difficulties. But we also need to consider the circumstances. Perhaps the first child was born when the parents were in their 20s. The second was born closer to 30. And the third was born when the parents were approaching 40. Those children did not begin life with exactly the same parental resource available to them. That matters. There's a difference between being born when your parents are at the peak of their health and vitality, and being born later, when their health has already begun to decline, and their bodies have accumulated years of wear and tear. Late childbirth raises many questions. I've encountered families where the first two children developed normally, while later children developed significant disorders. When that happens, we need to look deeper. Historically, large families even had a concept for the youngest child, the last born. People understood that the youngest child was often born to older parents and could be physically weaker than the others. This idea has existed for a very long time. Sometimes we simply need to analyze these patterns more carefully. When we approach these questions professionally, many things become understandable. The real question is whether we're looking for someone to blame or whether we're looking for a way forward, whether we're looking for guilt or for solutions. Now let's talk about autistic spectrum conditions. Where does this idea come from, that perhaps autism is not entirely negative? Perhaps it even comes with certain advantages. There is a well-known story about an autistic individual who flew over Tokyo in an airplane and later reproduced the entire city from memory, drawing it from an aerial perspective. And we look at that and say, my goodness, that's extraordinary talent. Then we start asking ourselves, maybe he didn't need to be restored at all. Maybe autism manifested itself through this remarkable intellectual gift. Or take someone like Perelman. People point to his social isolation and say, perhaps this is another example. After all, he made discoveries that few others could make. But we need to understand something very simple. What interests us is ordinary human happiness. And ordinary human happiness means that a person is socially integrated, socially engaged, capable of meaningful relationships, capable of work, equipped with practical life skills, and able to function successfully in the real world. That is what matters. Parents need to understand this. The overly active child may need guidance and restraint. The weak or depleted child may need restoration. And in general, we always have three major tasks when working with children: health restoration, education, upbringing. Those three things form a kind of triad. With these children, health restoration comes first. Then, education. And only after that comes proper upbringing. Because if a child is barely functioning, what exactly are we trying to correct through upbringing? First, we have to strengthen the foundation. Of course, there are also children who seem naturally healthy and resilient. Children who have more vitality than many adults. With them, the priorities may be different. Perhaps upbringing comes first, then education, and so on. But once again, everything comes back to an individual approach. If we were able to organize these children into meaningful groups, train specialists properly, and develop standardized methodologies, many things could be done more effectively. Methodologies could be written, techniques could be formalized, programs could be developed. But in reality, we work within the limits of our actual resources and opportunities. So most of this work is done on an individual basis. One child may be 4 or 5 years old. Another may be 10 or 12. And people ask me, is it reversible? My answer is yes. It is reversible. But it takes time, and it requires a tremendous amount of work. Suppose a 10-year-old child has never attended school and is considered unteachable. Can that child be brought forward? Yes. The question is, to what level? At the very least, such a child can often be brought to a level where they are capable of independent self-care and can acquire basic vocational skills. But even that requires an enormous amount of work. And someone has to be willing to invest that effort. Today we have a large number of autistic children. Who works with them? Mostly psychologists. And psychologists are often trying to extract cognitive and psycho-emotional performance from children who are already functioning on a very low residual energy resource. They are trying to increase learning capacity. They are trying to increase engagement. But the specialists who focus on health restoration and restorative care are often not involved. And yet the energy resource exists in the body. That is where it resides. Meanwhile, everyone continues trying to draw more from the child than the child is capable of giving. Look at adults for comparison. Today there are many programs designed to improve memory, increase associative thinking, accelerate reading speed, and enhance learning capacity. Many of these methods work, but they work for people who already possess sufficient energy resource. If the energy resource is not there, then after pushing the brain harder and harder, people eventually begin experiencing health problems as well. So we're really talking about the same thing throughout this entire discussion. We're talking about the economics of energy resource. We're talking about how energy resource is distributed. We're talking about priorities. We're talking about whether there is a lot of energy resource or very little. We're talking about whether it can be redirected, managed, or even supplemented from outside sources. And when I say that this condition can be treated, that another condition can be restored, that improvement is possible, I'm speaking specifically about my own methodology and my own technologies for supplementing energy resource from outside the system. From my perspective, that is what makes health restoration possible. But these are specialized methods. At present, we do not attempt to scale them widely, and I do not teach them broadly. Not because I want to keep them secret, partly because I oppose amateur and unqualified approaches, and partly because the scale of this problem requires something much larger than individual enthusiasts. It requires a serious institutional effort, perhaps even a governmental one, because this is not a local problem, it is a global one. Today, in much of the developed world, rural populations account for only a small percentage of society. The overwhelming majority of people live in cities, and not just first-generation city dwellers, but second, third, fourth, and fifth-generation urban populations. And with each generation, people tend to become weaker. We hear that birth rates are declining, fertility is declining, sperm counts are declining, rates of cancer are increasing, and many chronic conditions continue to expand. These are not isolated phenomena. They are all part of one large cluster of problems. Autism is simply one angle from which we can view that larger picture. Connective tissue dysplasia, scoliosis, neuromuscular disorders, myopathies, all of these belong to the same broader pattern. This is why a health restoration system is not just one treatment or one procedure. It is a comprehensive set of measures aimed at restoring overall health, restoring immune function, and restoring what I call the ontogenetic resource.